Hello, let's talk about implants. An implant is a way to replace a missing tooth. Now, what are your options if you have a missing tooth? Well, you can leave the space vacant, you can place an implant, you can place a fixed bridge, or you can place a removable partial. This would be a removable partial denture that fits into the edentulous spaces and it attaches to the remaining teeth. This would be a fixed bridge which attaches to the tooth on each side of the edentulous area. The reason they call it a bridge is because the teeth on each side would be the land and the missing teeth would be like the water. So it connects from the land across the water to the land. Or you can place an implant if you have enough vertical bone height for an implant. Now, what do I mean by that? That means if there's enough space between the top of the bone or the alveolar crest and the nerve, this nerve right here in the posterior part of the lower jaw or the mandible, if you have enough vertical space here, you can place an implant. And in the maxilla, you've got a sinus up here on both sides. And so if you have enough bone from the top of the bone or the top of the alveolar crest to the floor of the sinus, then you can place an implant in the posterior part of the upper jaw or the maxilla. There's usually not much of a problem in the anterior part of the mouth, the anterior maxilla or the anterior mandible. Now, what are the advantages of each? This is what implants look like, by the way. This is a root form implant, and these actually screw into the bone like this. For me personally, this is the way I look at implants. I normally don't like implants in the aesthetic zone. That means from cuspid to cuspid if the person has a high lip line when they smile. I mean, if they show the gum tissue, because it's very difficult to get the gums exactly right. You can watch my video on implants versus fixed bridges. I would prefer to have a fixed bridge in the aesthetic zone just because you can control the gingival line better. If it's a posterior tooth or a lower anterior tooth, I would normally prefer an implant because you don't have to floss underneath it. If you have enough vertical bone height in the posterior part of the mouth for an implant is a very predictable procedure. I have an implant right here. I've also got, I don't have any fixed bridges. I've got multiple, 3 or 4 other root canals, but the implant is probably the best tooth in my head. If placed right, they're very solid, very long lasting, very durable, very comfortable. Now, the way you normally place an implant, you extract the tooth. If it's a single rooted tooth, sometimes those implants are placed at the time of extraction. I often place the implant at the time of extraction if it's a single rooted tooth and we can extract the tooth straight out of the socket. And I usually do that with a system called the Easy Extract. It just takes it right out of the socket so you preserve the facial and the lingual or the palatal bone. Then you place the implant, you can graft a little bit around it. And I like to let that osseointegrate or heal for 3 months. That means the bone grows into the implant. Bone loves titanium, and that's what most implants are made of. And it actually grows into the implant, so it's almost impossible to take the implant out. It becomes like a part of the bone. Then after 3 months of osseointegration, the patient comes back. I take an impression. During that healing time, there's been a healing abutment going through the gingival tissue to create a proper emergence profile for the final crown. We take an impression, send it to the lab. The crown and the abutment come back, and you screw the abutment and the crown into the implant. So the implant itself is actually the part that's in the bone. You call the part that screws into the implant the abutment, and then you call the part that fits onto the abutment the crown. The abutment is always screwed into the implant. The crown can either be screwed into the abutment and the implant, or it can be cemented on the abutment. Most people would prefer a fixed restoration like an implant or a fixed bridge to a removable restoration, just because with a removable restoration it fits across the top of your mouth or behind your lower teeth, and food can collect underneath it just for a lot of reasons. Most people would rather have something that does not come in and out. Now, something we do a lot of are implant retained, removable, and non-removable prosthesis. This is a small diameter implant. You see it's smaller than the root form implant. A small diameter implant is less than 3 millimeters in diameter. And you screw those into the bone, let the bone osseointegrate, and then the denture has these housings that fit onto the implant, and they're very stable. You can watch my video on small diameter implants retaining removable dentures. We've also got implants retaining non-removable restorations called all-on-4 and all-on-6. So an implant's a wonderful thing because the bone grows into the implant if you give it time to osseointegrate. Now, I normally don't like to load the implant for about 3 months after it's placed. You think about a broken bone healing, it takes about 2 months. Well, I like to give it 1 more month so that you know the bone is solidly into the implant. To my knowledge, I've never lost a root form implant. Now, I've had patients come into my office that have lost implants. Most of those, the implant was loaded at the time of placement. Well, I grew up ranching, and I think of a fence post that you place in concrete. If you move that fence post before the concrete sets, you're going to lose the fence post, and that's what happens to implants many times that are loaded at the time they're placed. The occlusion of the patient moves, wiggles the implant in the bone so that the bone doesn't osseointegrate into the implant. There's a tendency to want to give patients the restoration immediately. Well, I'd rather have success, and so I don't ever do that. You know, we may give them a removable flipper, which is a partial, for a while if they want something. That's what I had with mine. I had a removable flipper while it osseointegrated for 3 months. But if you do it like that, you give it time to osseointegrate, you've got a high rate of success rate. Now, if it's a molar tooth, those are multi-rooted teeth. I personally don't place the implant at the time of tooth extraction. If it's a molar tooth, I extract the tooth and graft the socket with artificial bone or platelet-rich fibrin or a combination of both of them, and let that heal for at least 3 months. Then come back and place the implant, let that osseointegrate for 3 months, then take an impression, send it to the lab, and place the abutment and crown. So implants are a wonderful addition to dentistry, especially if you don't have any posterior teeth to hook a bridge onto in the posterior part of the mouth. You can often place an implant and place a bridge from the implant to a natural tooth. We used to think you don't want to connect bridges from implants to natural teeth. Now it's done routinely. I do it routinely, and I've had no problems with it. If you had a patient that was a big time clincher, there might be a bit of an issue because the implant doesn't give. The tooth has got a periodontal ligament around the tooth, which is like a shock absorber, and it will give just a little bit. So you might have an issue with the bridge disconnecting to one of the abutment teeth or the other if they were a big clincher. Be sure to put the patient in a night guard, though, to prevent them from clenching on that bridge at night when they're sleeping. So bottom line is, if the implant is given time to osseointegrate with the bone, which is about 3 months, and you don't load it for about 4 months, I mean, it take about a month to get the abutment and crown back from the lab. An implant is a very predictable procedure. Probably 95+% are going to survive 10 years or more. So it's a wonderful addition to dentistry. So that's the Dental Minute. These techniques work, and they work every time.